Hello, I'm Barb Winters. Welcome to McLaren Port Huron's Today's Health. You know, it's really important that you know what to do if you think you're having a heart attack. And joining us to give us this important information is board-certified interventional cardiologist B. Ramesh Reddy. Dr. Reddy, welcome back to Today's Health.
Thank you, Barb.
Let's start with the beginning. What's a heart attack?
Heart attack is a condition wherein the blood flow to the heart suddenly stops, and as a result of that, patients have chest pain, some electrical disturbances. It could be fatal, as you very well know.
How common are heart attacks?
It's fairly common. It's probably the #1 killer in all men and women, so it's as common as that.
And who's most at risk?
Typically men over 45, women over 55, those who have diabetes, those who have high blood pressure, who smoke. These are all the people who are greater risk, and especially if you have a family history of heart attack. These are the risk factors that make you more likely to have a heart attack.
So to reduce your risk, you stop smoking.
Obviously, stop smoking and take good care of your high blood pressure if you have it well controlled, and try to keep your cholesterol down so the risk of having a blockage decreases. And also, if stay active and exercise on a regular basis. These are the things everyone should do so that we do not have any heart-related issues like a heart attack or angina or any of those.
So would you say it's possible to prevent heart attacks if you do all of these things, or is age such a factor that you really still need to pay attention?
Well, certainly it can be prevented. Now, whether you can prevent 100% or make the most of it, it's debatable. But I think in reality, if you have the risk factors, knowing that you have them is the first thing, and then dealing with each risk factor and reducing the chance of a heart attack is something you can certainly do. You can reduce the chances to a significant number, probably not to zero, but still that's a big change in terms of preventing a heart attack.
Pretty important, something to pay attention to.
Absolutely.
So what actually causes a heart attack?
The concept, this is really a concept, but probably the most acceptable concept is that when the blood is flowing through an artery, there is some amount of plaque built up or a fatty tissue built up within the artery, which reduces the rate of how the blood flows. In this blocked artery, then a clot develops, and once the clot develops, it blocks the blood flow completely, and that's when people have a heart attack. Now, what exactly is the trigger for that clot to develop, and in whom it develops? We have some knowledge, but we don't have all the answers. Patients who smoke, those who have diabetes, those whose cholesterol is high, these are the ones in whom the likelihood of a clot forming is high.
So what actually happens when there's the, sudden, there's people that just have chest pain, and then there's the people that just, have a fatal event. What's the difference there?
The difference is, let's say you have a decreased blood flow in an artery. When you have a reduced blood flow and when you are doing physically a lot of activity, you need more blood flow, and that is not forthcoming through a narrowed artery. That's when people have discomfort in the chest, which they can call as chest pain. When they stop the activity, the symptoms get better, and that we call it as angina. Now, a more acute version or a more severe version is when the blood flow is stopped suddenly. That's when the pain is irreversible, persistent, they have heavy pressure in the chest, break into a sweat, and that's really more of a heart attack. And you need to take some measures to reestablish the blood flow at that time.
So the symptoms you just went over, really, they can be from pretty mild to very severe.
Could be. There is a varying intensity. You can start off as having just a discomfort, an uncomfortable feeling, heaviness or pressure in the chest, or I just feel nauseated, or I have a jaw pain. From there to a sudden excruciating pain, which is like an elephant sitting on the chest, you break into a sweat, and you're pretty much extremely weak. So there is a spectrum of symptoms, as I would say, and the disease process is pretty much the same.
Are there differences in symptoms for men and women?
Women sometimes don't have a very typical symptoms as men do, but I think it's important to realize that whenever you have an uncomfortable feeling in the chest that occurs with activity, don't try to diagnose yourself, go and seek medical attention, and don't blow off the symptoms as if they are nothing, and that's what we tell them. Women tend to be more dismissive, I should say, of their symptoms sometimes. But again, there is no hard and fast differences in how the disease manifests itself. But women sometimes don't have as typical symptoms as men do.
So rule of thumb is if you have symptoms when you have activity and they stop when you don't, you need to talk to someone.
That is definitely one way of doing it. And if you have any uncomfortable feeling in the chest, let's go to somebody who can answer your question, and that is a physician, your family doctor, or give a phone call and tell him, I'm having the symptoms, and you'll get the attention. Just don't blow them off.
Okay, yeah, you're right. Women are very dismissive. don't want to pay attention to that. What should you do if you think you're having a heart attack?
First thing I would do is, if you're having discomfort in the chest, you're at home alone, pick up the phone, call 911, make sure the door is open, take an aspirin, and wait for the EMS to come and do their job.
Well, how about, when you're feeling really anxious because you think you're having a heart attack and you're not very far from the hospital, a couple of blocks, can't you just jump in the car?
As a safety measure, it's probably not such a good idea, because if it is indeed a heart attack, if that artery is blocked, you not only have chest pain, but you can have electrical disturbances wherein you can have a very rapid heart rate, you could collapse. And for that reason, I would say don't venture out in the car alone. If possible, call 911, and if there's your family or your loved ones, and have them call 911 and let them do the driving. That's what I would suggest.
Okay, good advice. Well, we're going to take a break. We'll be right back and have more discussion.